So thank you for having me here. It's been a pleasure to watch you and to join you today. So I'm excited to be here. But me, I am Emily Van-Otoo. I'm a nurse practitioner. Mm-hmm. I've been in nursing for over 15 years. At this point, I became a nurse practitioner in 2000. I've been a nurse practitioner since 2014, but I've been in nursing for that time frame. Mm-hmm. But I started my med spa back in 2020, officially opened to the public in 2021. Mm-hmm. And one of the initial services I did start to offer was the IV infusion. Mm-hmm. And I can get into why I opened up and everything later. Okay. But you mentioned the IV infusion, so I'll just touch on that. Okay. That was one of the initial services that I offered. I've done IV infusions a lot in the hospital. And I'm also aware of everyone needing vitamins and minerals on a daily basis, especially if they're not able to get them from their daily food intake. Mm-hmm. But oral vitamins is one of most people take oral vitamins, and there's no FDA regulations on the quantity of the vitamins that we take over the counter. And most people, I don't know if they know that, but there's no regulations.
I didn't know that. Yeah.
And also, so you can buy one bottle of the same brand one day and then buy another bottle of the same brand another day, and the quality of it may vary because there's no regulations by the FDA for that. So I'm unaware of the people taking the oral vitamins. So injectable vitamins goes directly into your bloodstream. So when you take them orally, you're also only going to absorb a small percentage, somewhere about 40% of the vitamin that you take in orally, you're going to absorb into your body because it has to bypass your digestive system. So
hold on, I need to jump in just to clarify. So you're saying like when you take the vitamins orally, you're only getting 40%, or is that with
you don't get all of the vitamins.
Oh, wow.
You're only getting about 40% of that vitamin.
Wow.
But when it's infused directly into your bloodstream, you're getting 99 to 100% of that vitamin absorbed directly into your bloodstream. So you get more optimal benefits because you're getting all of the vitamins and mineral nutrients that you're taking. So some people always say, well, why don't I just take my vitamins orally? Well, this is why people may want higher benefits of their vitamins by getting them injected. So the IV is the best route. Then you can have like liquid vitamins. That's the next best route. And then the oral vitamins. But IV is always going to trump all of the routes for taking in your nutrients.
Okay, so with the IV infusion, like what is the frequency of, or I guess recommendation on how often you should get the IV infusion?
Well, everyone's needs are individualized. But typically, I tell people to do it every 2 weeks. Mm-hmm. And then some people can even space it out longer than that at some point. But every 2 weeks. But it depends on what you're getting your infusion for. So there are a number of reasons why you can get an IV infusion. You mentioned people getting it for the hangover. So that is one reason for the hydration, either to prevent dehydration and having those hangover side effects after having a night out, bridal parties or whatever. It's going to be, there's going to be a lot of drinking involved. Mm-hmm. So you can pre-hydrate. You can, if you end up not pre-hydrating and you have hangover, you can have vitamins and the hydration or even some medications to help the nausea after a night out. So that's the one benefit. But people can get IV infusions for pain relief. You can get IV infusion for migraines. You can get IV infusions to help boost your immune system. You can get IV infusions to help with your hair, skin, and nails. There's IV infusions to boost your immune system, to help with athletic performances for athletes, to boost your endurance. And then they alleviate, again, the pain. So those are the main IV infusions. Then there's IV infusions to just help with detoxification and regenerating cells and overall nerve and mental health as well. So there's a lot of things you can get IV infusion for. It just can be customized for individuals.
I'm so happy that we're talking about this. I mean, you said, first of all, I deal with back pain, so I'm definitely, I'm for it. But then when you talk about the migraines, like I even have a cousin who struggles, she suffers with migraines, and she's been trying all these different medications and all these different remedies, and she just can't find anything to work. So maybe this might be something that she can try. Hair, skin, and nails, which is really important. And what else? So when someone comes to get this treatment, then how long is the treatment? Or I guess like how? Yeah, go ahead.
The initial treatment is usually the longest one because I usually do a consultation prior to go over health history, risk benefits, all that. So usually I say the first treatment can go anywhere from 45 minutes to an hour, and then treatments after that can go a lot faster, depending again on what is being infused.
Okay.
There are some IV infusions that can actually take 4 hours, but
really, and what would be a reason why an infusion would take 4 hours?
Just because they have to be infused slowly, it cannot be just pushed in too quickly. So
got you. Okay, so with that, when you talk about consultations, I saw on the site that, you recommend consultations and you recommend for a person to be healthy. Now, what would you consider healthy?
So it depends on the treatment, but generally, I don't want to have anyone come in for, especially the aesthetic treatment, if they're smokers or uncontrolled diabetics, certain implantable devices, certain treatments cannot be done with patients with certain conditions, uncontrolled immune system. They have poor wound healing. So I have to assess based on each treatment who is appropriate for certain treatments.
Got you. So now with this, I also saw that there are treatments for eye squinting and palm sweating. And I know for me with the eyes, I've been meeting with clients via Zoom for about 4 years now. And I changed my screen to the blue lights. Are they blue light glasses? Oh, okay. So should I get some of them?
Yes.
Okay. So where would I get these from, Emily?
I got these from Amazon, but if you wear glasses, your ophthalmologist or optometrist can help you out with them as well. But yeah, I wear blue screen protected glasses all the time because I definitely feel the screen time have an effect on my eyes. So I try to wear these as much as possible. I wear corrective lenses too, but when I know I'm going to be on the computer or the phone for a long period of time, I'm definitely protecting my eyes.
So what are some other ways to, I guess, prevent eye squinting or with eye treatment?
So those are the main way is making sure you have seen an optometrist and don't need corrective lenses. So that's a lot of times they'll cause people to squint their eyes. If you're out in the sun and you're not wearing sunglasses, so that's another reason that'll cause you to squint your eyes. So I don't do any treatments per se for eye squinting.
Okay.
I do treatments that if you squint your eyes for long periods of time and develop wrinkles around your eyes, then I can help reduce the wrinkles. But you want to do stuff like wear blue light protective lenses, see an optometrist, make sure you're wearing your corrective lenses so you're not squinting all the time, wearing your sunglasses when you're out in the sun, so that, again, not squinting. Wear sunscreen around your eyes, protect your skin from developing frown lines and wrinkles. But if they develop where you want to prevent them from developing, then you want to do treatments like Botox or microneedling.
Oh, Botox. Yeah, so that was another thing. So, I'm not someone to each his own, right? I've never felt the need for Botox, and that's probably why I've just never done any research about Botox. I was never really open to that experience. And that there are some negative feelings about Botox and stereotypes because of the pressure that society puts on people to look a certain kind of way. And then people are getting these cosmetic surgeries to portray a certain image, but the internal work hasn't been done. So what are some myths or common misconceptions about Botox?
Common misconceptions are that if I get the Botox, it's going to make my skin worse when it wears off. That's the main common misconception. Or people think that, I don't have enough wrinkles yet, so I don't need to get them yet. Those are the main misconceptions that I see, is mainly that people think it's going to make their skin worse off than what it is. And that's not true. Botox actually, so your face is a muscle, and every time you're moving it, you're talking, you're making facial expressions, all you're doing, as if you were going to the gym and lift the weights for your arms, you're just making those muscles bigger and stronger. So if you wanted to prevent strong wrinkles and facial muscles as you age, you can do things like Botox. Now, people may not also know that they may have a misconception that Botox is only for cosmetic purposes. There's a lot of medical purposes for Botox. Again, migraines can help reduce the pain of Botox can help reduce the pain of migraines. If you have some kind of twitching around the eyes, which legally I don't know if that is an indication, but I do have an eye twitch, so I'll do Botox and it'll help with that. And that could also be due to me needing stronger prescriptive lenses. There's some research being done about how Botox can help with depression. If your face is looking fat and droopy and frown lines and you're just seeing yourself looking angry, that can have an effect on you mentally, internally. So if your face is more uplifted and bright because you have Botox to help lighten up your appearance, then that can make you feel good mentally. So they're doing some research now about Botox and the effects of depression.
You know,